Welcome to Opinions, everyone. I'm your host, Michael Dersham, aka Dersh, founder and CEO of Apierion. As you know from past episodes, these live conversations, we try to bring together experts, innovators, collaborators, all across the greater health tech space, not only within the U.S. but globally. And what we try to do is have an open, dynamic space where we can just chat about some of these things that are going on, spark some fresh approaches, some new ideas, and raise the level of discussion in some of the biggest issues in healthcare today on a global scale. Um, today's episode is lions, tigers, and pets. Oh my, and vets. Oh my. We're going to look at and talk about the correlation and contrast between animal health and human health, also as it relates to tech, data, blockchain, AI, all that good stuff that we've been talking about. Uh, Today we have well, it seems like it's starting this trend out there. In last episode, we had Sonia and Sabine, and I felt like again a thorn between two rock star roses, and the same thing is today. Uh, we have joining us uh, Dr. Cindy Otto from the University of Pennsylvania, and we also have Dr. Jenny Woodoff, uh, who's been a longtime friend and confidant of mine, and brings a real perspective not only from the vet area but also in her background in biohazardous threat and infections diseases. Um, she's also a consultant in those areas and an adjunct instructor at Georgetown. So, without any further ado, did Cindy join us yet? Did you see her? Um,
I do not see her yet. No.
okay, well let's jump in, Jen. We'll at least get started. Can you give a little bit of background on yourself, and then we'll jump into some of these discussions around One Health and as it relates to human health and how that can work on both sides of the aisle, so to speak.
Sure, Dersh, thanks. You did give a little bit of my background. I've been a small animal veterinarian for nearly 30 years. For about 10 years, I have been a subcontractor and consultant in the federal government and the biodefense world, as well as an adjunct teaching One Health at Georgetown University at a master's level. I guess my transition from strictly small animal, and I continue to do that practice, but into One Health was really sparked by the fact that I saw huge gaps in knowledge between the animal health world and the human health world, and how they relate together. So,
Well, I see Cindy joined us. Cindy, if you accept the button from Andrea, there we go. All right, cool. Cindy, thanks for joining us. If you wouldn't mind giving a little bit about your background, and as well as then just your initial thoughts and definition around One Health, and then we'll get to it.
Yeah, absolutely. Thanks for having me. So I am Dr. Cindy Otto. I am a veterinarian. I have a PhD in veterinary physiology, and I have clinical specialties in veterinary emergency and critical care, and also canine sports medicine. I have been involved in One Health mostly from an emergency and disaster response perspective, and have worked with the Pennsylvania Task Force and deployed to Hurricane Katrina, to New York for 9/11, and have really implemented a lot of that in my education, teaching, and research. And as a result, we opened the Penn Vet Working Dog Center, where we raise, train, and study working detection dogs.
That's awesome. Thanks, Cindy. Jenny, you were saying, as you started to see gaps as it relates to One Health. I mean, I look at it. I guess my definition is probably different than you guys, but in my kind of basic definition, and again, correct me if I'm wrong on this, but it's the notion that what happens to that animal is a precursor or a preface to what is most likely to happen to that human, whether that be in the home, like it's been described to me that because a dog or your pet is constantly around, sniffing around, is in the carpet fibers, and can that be a leading indicator to what happens to that family's health? And similarly to what Dr. Otto had said about, whether it be 9/11 or a train derailment, what happens to those first responder dogs can be a leading indicator of what's to come in that human health. Am I in, on the right
You're
track? No pun intended.
definitely on the right track. So the way I like to think about One Health is it's how people, animals, and the environment interact, and what it means to like global health. So how can we gain knowledge from animals, from my perspective, to help solve some human conundrums, like what are we expecting to happen in humans based on what we're seeing in animals? So from your perspective, what you're talking about is using animals as sentinels of disease. And I think it's a very valid way to approach One Health, and not to make it seem like we're using these animals in a harmful way, but by their very nature, they're exposed to like 43 times the toxicants in the environment that we are, because they're not walking around with shoes on, and they're laying down, and they're eating things on the ground. So their exposure happens much more quickly. And also their body mass makes things like toxicants in the environment build up much more quickly than it would in a human. So we can use animals as sentinels of disease, and hopefully use that data and inform what could be on the horizon for humans.
Yeah, and feel free, Dr. J, I know you're so kind. Feel free to call me out if I say anything wrong. But what's interesting to me as well, when you talk about this sentinel and this leading indicator, is it that we're able to? I mean, is the data there that we can on a dynamic basis build predictive models of what can happen in certain regions? Or are we looking at more retrospective data, trying to learn from that, and then address that in future in future scenarios? Is this one of the data gaps that you guys talk about as well?
It is one of the data gaps. I do feel right now things are very much in a retrospective fashion, which is great. We're gaining a lot of knowledge, but to have something a little more dynamic, there are certain aspects that we are using animals in disease and toxicants and things like that to be a little bit more predictive, but they're sparse and scattered. So the opportunity is there. We just have to figure out how to make it work.
I would jump in on this as well, because we've done both the retrospective and currently actively involved in clinical trials in canine disease, spontaneous canine disease that mimics or parallels human disease. So when we're looking at disease in these dogs, it's a disease that has, there's been a lot of research, and the one that we're currently working on is what's called septic peritonitis. So it's an infection that happens oftentimes as a result of a disruption of the intestinal tract. So they leak contents into the abdomen, and things get really serious. People get really seriously ill. Dogs get seriously ill. There's been a lot of research in this area, but using experimental animal models, and it really hasn't helped advance medical care. And so we have advocated and currently have an NIH-funded study looking at dogs that spontaneously get this, whether it's because they ate a barbecue skewer, or because they had some other rupture of their intestine from some other disease. And they get all the same care as humans. And so when we're doing these studies, we're helping dogs simultaneously helping humans. So the One Health part that I like is that it's so intertwined, and that is, information that we can gather from dogs can help both dogs and humans.
Thanks, Cindy. Cindy, how does that, like in that clinical trial, are you working with folks from the the human side of the, and I call it the aisle, but the human side of the aisle during this clinical trial, where you're looking in parallel, these spontaneous disease states in both pets and human, and tried, or are you working in more isolation with the dogs, and then presenting that as within medical journals for your your human colleagues to to review?
We're currently working more in isolation, sort of. These would be considered preclinical studies, where we're looking at things that might then translate into human clinical trials. So that's the value of looking at in the dogs, is that we can, as long as we have safety information for the dogs, we can use these drugs in the dogs and monitor them and care for them and get that information. And if it looks like there's an impact, like a benefit for survival, then the human researchers, the clinicians, will be able to take that into potentially human clinical trials. Same is true with cancer. Lots and lots of trials that have happened with natural cancer in dogs, and some of those have now translated into trials in humans.
It would seem to me that it would be important as part of these clinical trials, to also, at the same time, be collaborating on the human health side. Is that something that you actively try to pursue, or is that something that just historically it just doesn't happen that way?
There is collaboration. It's just more sort of sequential or parallel, and definitely on this grant, we're looking at it from all aspects, and so there are a number of human researchers as well, and we're just one arm of a much bigger project.
How do you collect the data, and because I would think that you're in disparate locations, and dealing with whether it be pet owners or your rescue areas. How do you try to thread that needle of kind of data interoperability between those?
No, I think that's one of our biggest challenges, that we don't have that ability. I look back at the retrospective study. We followed 95 dogs that responded to 9/11 for close to 15 years, or till the end of their lives, and the data that we were able to collect was variable in quality, variable in source, and we just had to sort of piece through it, and that was really challenging. With our clinical trial, it's in a single location, but if we're talking about multi-center or other, expanding these trials, then they will need to be multi-center, and then there is that whole sharing of data and having it be equivalent, and that is a huge problem.
Mm. Jenny, did you also see that in the work that you've done, for instance, in the biodefense and biosecurity area, the the lack of data that you're able to collect across different areas and make some determinations or predictions around that data.
Absolutely. It's widely variable. There are so many things that occur in the animal health sector that they go uninformed to the human health sector, even though they're shared diseases. And it can vary by district to district, state to state, disease to disease. Some diseases are reportable in humans, and that very same disease is not reportable in animals, even though those animals could serve as a sentinel of what's coming in an outbreak in the human population. So it is very disparate, and it's very difficult to really hone in on that data and use it in a useful way.
Mm. I mean, the more I talk to you guys, the more. I mean, it's great the work that we're doing, but the gaps, whether it comes from just data and tech, or where that's coming from decisions that are being made where something is reportable, something isn't reportable. I think is it's very interesting. I'm going to shift a little bit. I think it still is relevant within the One Health discussion, and I may, and you guys can correct me on this one, if I pronounce this wrong, but the notion of zoonotics, which is that animal to human transfer of a disease. Is that something that is part of One Health, or is this something, because of course we heard a lot about that during COVID. We hear about that in what things like avian flu and others, but it seems to me, especially with the with the world and the way that we're coming together as communities, as countries, that these types of zoonotic episodes are going to be ever more increasing. And if that's true, what are steps that we can do from a data perspective, again, AI perspective, to try to predict these or see those earlier, so that we can mitigate those risks?
Yes, absolutely. The risk is going to increase. We like to say in my world that diseases know no borders, especially with the way people and animals move around the world. Today, it's much faster paced. It's very difficult to track animal movements. It's almost difficult to track animal movements within a territory, let alone from state to state, country to country, because the rules are different everywhere you go. So gathering that data can be really, really difficult. But I think it will become more and more necessary if we want to be on top of these outbreaks. So 75% of new emerging diseases in humans are from animal origin. And we as veterinarians, I think, embrace that concept of One Health faster than they do on the human health side, just because all of our creatures that we care for, there's a human at the end of it. So there's a human at the end of the leash or the lead, or for a rescue dog, there's a human component that they care about, or for conservation, there's always humans. So we understand the sort of concept of One Health. But I think it's becoming a much more prevalent thing with the more frequent disease outbreaks, because we've had quite a few over the last 15 years, not only the last coronavirus, but we had SARS and MERS.
Yeah.
So we're always seeing new outbreaks of diseases.
Does it go the other way as well? Does it go from humans to animals?
It does. And our classical definition of zoonosis is a shared health disease, like a shared health concern. Some people like to call it a reverse zoonosis when it goes from a human to an animal, but it's that mixing sometimes, particularly with like the influenzas, because if it's going from species to species, and it can go from, you know, chicken to a pig, and that mixing can cause things to change as far as transmissibility. But humans can also transmit those types of diseases to animals, including pets. So it is a very, very big shared health concern.
I love the way that you're able to pronounce zoonosis or zoonotics, because you really do have to, the proper is to put that O right after zo. Is that correct?
I guess that's just the way we.
I was trying my best this morning to practice it, and so I knew you guys would get it right. But anyway, tell me about the transportation of animals and pets. Uh, you see it from from a sporting perspective. You see it again from just a regular pet perspective. Can you talk a little bit about what that means, either from a health perspective, coming in and out of countries, the requirements where I think you touched on that can be different, within that, and then again, is there a way that we can, by using tech, by using data, by maybe putting, these these animal records, at least pointing to them on blockchain, uh, can that help on, talk a little bit about those challenges and what you guys see, and then how you think different tech platforms could come into play.
Well, I'm gonna let the techie geeks figure out how to make that work. But yes, it would be very important to get more actionable data if we could really figure out how to gather that complete picture, whether it be a pet, an animal product, animal used for commercial reasons. If we could get a better picture of how that animal is moving through the world, its environment, where it's going, where it came from, we would definitely have a better idea of how to manage disease outbreak. But it has been a big challenge because everyone has their own rules and regulations, and it can be very difficult to figure out what rules and regulations apply to what animal or animal product or animal movement. It can be a bit of a challenge to figure all that out.
Yeah, I can imagine. Cindy, how's that, like with the first responder dogs, state to state, or even the Defense Department dogs?
Yeah, absolutely, Darsh. I was thinking about that, that it's not limited to international travel. Thinking about how when we responded to Hurricane Katrina, how all of these dogs from all over the country sort of descended upon Mississippi and Louisiana, where there are diseases that are very different than there are in the Northeast or in the Northwest or the Midwest. And so having the ability to track that exposure, to track the risks that they have, and to be able to deal with that is huge. And, again, the Hurricane Katrina example, there were so many dogs that were brought from that area and then fostered and adopted all over the country, and with very little knowledge of what their medical status was. And we know that some diseases were spread as a result of that. There was an increase in heartworm disease because all of these dogs that had heartworm were then, moved to areas where heartworm was not as prevalent. And so thinking about, how do we keep on top of that and track that for animal health, but also for human health?
Yeah, for sure. I'm going to go somewhere. It might sound a little bit crazy, but I think there could be a bit of it. So the last opinions that we did was around diaspora, and in particular India diaspora, and diaspora is that movement of a certain region of people into other regions, and so I was thinking about it overnight. Is there, again, could be just crazy Dersh naive question, because I love talking to you guys about animal health, but is there a diaspora as it relates to animals, for instance, like French poodles or German shepherds, or as these you know lineages are moving across different geographic areas? Does it tell us anything about disease spread, breeding practices, genetic health, within certain populations? Jenny?
Yeah. So, yeah, that's a tough question because there are many different systems to track many different aspects of, say, pet health, particularly from a breeder perspective. So people that are breeding animals, there are genetic testing, there are radiographs, x-rays of various joints and things like that. And a lot of the data is, again, kept in very siloed areas. So we don't necessarily have population level health data to inform decisions. It's not for lack of trying. The AKC definitely is trying to improve breed standards. They have their system, but dogs are coming from other countries that have their own systems and requirements for breeding and pedigrees and things like that. So yeah, it can be a bit of a challenge.
Yeah. How about you, Cindy, on the French poodle diaspora?
I think I'm going to stay away from the French poodles, but I will talk about the German Shepherds and the Belgian Malinois.
I knew you would, so that you know I was going to tee up something for you. But,
absolutely. So the really important thing to think about is that our law enforcement dogs and our military working dogs, the majority of them are imported. And they're imported mostly from Eastern Europe, but now some from South America and Central America. And these dogs are all coming in with, some supposedly a health document, a health passport, but it's really hard to track. It's also hard to make sure that that document that's coming with that dog actually belongs to that dog. We have very little information about their genetics. There is not much information shared. We don't know pedigree information on most of these dogs that are coming in. So there is a big gap in our knowledge, and we do know that there are certain predilections for disease in these dogs, and there are requirements for screening of the x-rays, particularly for their hips, that help identify those dogs that might not be suitable. But there's a lot of other things that we're not even able to pick up that we could if we had better pedigree information, better and traceable health information.
Interesting. Is there any key policymakers that take this whole One Health, animal health, correlation over to human health? Is there anybody, in DC or even where you guys are in the state of Pennsylvania that really step up for these challenges and try to have a voice heard around these issues? Because it seems to me that there is such a direct correlation, that we do have known risks, that there is gaps in data, and yeah, we can all work collaboratively to try to transform that. but I'm just curious: is there somebody out there that that has the megaphone that's trying to talk about these issues?
I don't know, Jenny, what you think, but I would say there's no megaphone, but certainly we have veterinarians in various places like the Centers for Disease Control, the Food and Drug Administration, the USDA. There are veterinarians that are out there, and definitely I think that this would be, it's almost a little bit of a holy grail that
Yeah.
there's nothing out there yet that they can then be advocating for. It's a bit of a dream, I think, at this point.
I agree. I definitely think that there are champions of One Health, but no one that has the high profile to really put it in the public forefront. Lots of, government advocates for One Health exist. It is a little bit of a concept to get your head around. So I do think that people don't necessarily understand what we can do to promote One Health.
Yeah, it took me a couple times for you guys to tell me what it is. I'm still trying to sink it all in. But just a couple minutes left. Cindy, any parting thoughts? And again, we appreciate it, our audience appreciates it. You guys were just fabulous. Any parting thoughts? I mean, you said, could be or Jenny, the Holy Grail, or, is there anything that we as business folks, tech folks, advocates now for One Health that we can do, or what's on your wish list, anything like that as we end this episode?
Well, I'm going to take an approach that's a little bit of a selfish approach, but is still One Health, because we know how important our animals are to our own well-being as humans. And so because I care for patients in the hospital, and I see patients that may have been seen by numerous other veterinarians, or have various medical records scattered all over, it's for me to provide the best care for a pet, a patient, a working dog. It really helps to have the information. I can make better decisions. I can actually be more cost effective if I know what's been done, if I have access to other records, and I can do better for that animal and for their owner or handler or partner. And so that for me is really an important thing that I'm looking at. And then from a disaster response, when our teams respond to a disaster and pick up everything and go someplace, both the human and the dog are exposed to the same kind of risks or more. And we studied the dogs in following 9/11, and looked to see if they were going to give us some indications of problems that might show up sooner in the dogs than in the humans. Actually, in that situation, surprisingly, the dogs were much more resilient. But knowing what's happening with both the humans and the dogs can help truly give us a One Health approach for the health and the well-being of all species.
I agree. I would like to be on that selfish aspect as well. Just having the complete health history of a patient is so helpful in what I can provide care for. And I have to spend so much time trying to gather that health data from very disparate systems that it can take me a while. It can take me a long time to gather all the information I need to make an informed decision for what's going to be best for that patient.
Yeah. Well, with that, again, I want to thank both of you for taking some time out. Very, very interesting stuff. We'd love to have you come back on another episode as we continue, our road to try to drive real, transformation across healthcare and medical commerce around the globe. With that, thanks to everybody for listening in. And as we end all the time, healthcare to human care. And we'll see you around campus. Thank you.
Yeah, thanks for having us.
Yep, thank you, definitely.